Alright, so I'm the clinician, Cassie's the client, and my scenario is that she has Broca's aphasia and has been in therapy for a little while now, but she's still kind of self-conscious about her speech. Ready?
Yep.
Okay. Hi Cassie, how are you today?
Good.
Good. How are things going just at work, with life?
Okay.
Okay.
Work is tough.
Alright. You're feeling like work's a little tough. Can you tell me a little bit more about why, maybe?
I don't think the employees are looking up to me.
Okay. Can you give me an example of maybe why you're feeling that way?
I think have weird looks sometimes, and they laugh when I'm not looking.
Oh, okay. So you think they might be laughing when you're not looking. Have you seen someone laughing at you?
No.
No. Okay. So, do you think that maybe they might not be doing those things, and maybe it's just a little bit of your worries, or you're being a little self-conscious about your speech just because it's been so hard for you?
Maybe.
Okay. Because I'm just thinking, you've been in speech therapy for a little while now, and thinking back to when you first had your stroke, you've made a lot of improvement.
Mm-hmm.
And I think a lot of the time you're very intelligible in conversational speech, and people can really understand you. And so I'm just kind of wondering if you can give me any examples of why you're feeling that way, or if you think.
Yeah, well, I can communicate and tell people what to do. I think sometimes I worry that they think I'm not good at my job.
Okay. I think, yeah, I definitely can understand why you're feeling that way, maybe, and it's a real feeling to have, and it's understandable for someone who's had a stroke and has come so far. I think we're doing a really good job in therapy, though, of teaching you some ways that you can advocate for yourself and maybe explain to people when there is a communication breakdown, just that you've had a stroke and you have aphasia, and sometimes they need to be patient.
Mm-hmm.
But I also think a lot of that, I mean, you are very intelligible in conversational speech, and you're doing really well, so I think maybe it would be beneficial for you to more just focus on that in your head and tell yourself that when you are having these thoughts, that most of the time they probably can understand you, and just kind of have to get over the fear of feeling like they can't.
Okay. So talking to people about what happened?
Yeah, do you think that would be something that might help you if you were feeling a little bit of communication pressure, just saying, like, I might need a second to work through this? And
yeah, I think that would help.
Yeah. All right, good. Let's try that, and then next week when you come back, we can talk a little bit more about how it went and how it felt, and if it helped you at all.
Okay.
Okay. Good. Done.
Yep.